Data from the CDC shows that Indiana is one of several states not reporting probable COVID-19 cases, despite recommendations from the agency. CBS 4's Kelly Rinke tried to find out why and if there's any possible harm for not doing it.
COVID-19 data on the ISDH dashboard shows there are more than 38,000 confirmed cases in the state. It also lists the number of probable deaths. What Hoosier health officials do not publish is the number of probable cases, and Indiana is not alone. Data from the CDC shows it is one of more than 25 states that do not report probable cases to the agency.
We just, like most states, do not report that, and we just don't report it on our website. There's no particular reason for that.
State Health Commissioner Dr. Christina Box explained the state does keep track of probable cases, which an individual physician could report.
If they come in without a documented lab test, but the symptoms and the signs were appropriate and everything else looked like a probable case, then we keep track of that.
Do you think we're okay by not doing that as other states across the country are doing that?
Sure. Well, I would start by saying I think Indiana has some of the best data in the country, given our very connected digital health infrastructure.
Sean Granis is the vice president for data and analytics at the Regan Street Institute, a research organization tracking COVID-19 in Indiana.
If we're not only finding the people who definitively test positive, but also those people who look like they may have had the test, we might be able to piece together the infection trail more effectively.
He sees value in gathering data on probable cases of COVID-19.
I think that the more data, the better. And really, it's a case of prioritizing resources.
In April, the CDC began including probable cases in its total count. That change was made to reflect this statement from the Council for State and Territorial Epidemiologists. CST also recommends states report probable cases. It believes not doing this may limit fuller understanding of the pandemic.
For Indiana, I don't know that identifying these probable cases is going to help as much on the infection fatality rate side as it will understanding how disease spreads.
In Indianapolis, I'm Kelly Rinke, CBS 4 News.
And even without public data on probable cases, Sean Granis that you saw there believes that Indiana is still able to monitor the disease very closely.